skin resurfacing. So that's the third component. We have the gravity changes, we have the volume changes, and then we have the skin changes. And for the skin changes, I kind of mentioned this briefly. We like to do dermabrasion for the most, I guess the deepest wrinkles, usually around the mouth. Nothing really works that well. Laser doesn't work that well. Filler helps, but dermabrasion is probably the most effective. It's also has the most downtime and is the most invasive, and so we don't do it. I usually do it with facelifts because they're already recovering. CO2 laser also is a great resurfacing procedure. It doesn't completely take away every wrinkle, but it does improve skin texture, quality, and fine lines. And then as we're going down this list, we're kind of going to less and less invasive things. You maybe have heard about PRP. That's basically taking your own serum and either injecting it or just applying it to your skin. And there's a lot of research that the growth factors and the antioxidants in PRP are helpful for the skin. And we sometimes do that in combination with laser resurfacing, venous viva, or microneedling. And you can talk to our staff more about that later if you want more details about those things. And then chemical peels. There's deep chemical peel, and then there are superficial chemical peels. And I push these a lot to my patients. Chemical peels it's like one step beyond skincare. It's just turning your skin over. It's keeping it refreshed and rejuvenated. And I've had a lot of patients come into my office that are in their 50s or 60s, and they have this amazing skin, and I ask them, and sometimes it's just, this is what my mother looks like, or this is kind of our skin, but a lot of times it's, well, I started doing Botox 10 years ago, and I do chemical peels, and I take good care of my skin. And a lot of times those patients, they're 50, they're 60, and they don't even look like they're aging. They don't need surgery. This is Nisha after her laser. She's been a big part of our practice for a number of years, and she said this was her favorite thing that she'd done was the laser. And I think we did some video of that. Maybe we have it on our website when she did that a couple years ago, I think, or a year or so ago. Here's another example of a laser, and you can see what it does is it takes away a lot of that pigmentation, fine lines, and wrinkles. It doesn't take away everything. It doesn't lift the tissues. It just retextures and resurfaces the skin. Usually I like to do it with or in conjunction with a facelift, because if somebody has skin damage, or if they have facial aging, a lot of times they have skin damage as well. So it works well in combination with facelift. We use topical numbing. It's done in the office under local anesthesia, and it's very safe and effective. Here's just a really exciting video clip of the laser, unfortunately, a chatty patient. Unfortunately, this is sped up, so it's kind of a slow, I hate to say boring process for me, but it is a little bit that way, and maybe for the patient as well. But it's really effective, and we do a lot of it. Dermabrasion is to, as I mentioned, a lot of times the fine lines around the mouth. These are really tough to treat, and most people that have these aren't smokers. Sometimes they are, but dermabrasion. This has been dermabrated, and you can still see she has some lines, but they're just greatly improved. You have to be real careful with dermabrasion. If you go too deep, then it will scar the skin and make it look unnatural. This video is kind of on its side, but that's just kind of showing. It's this little wheel, like a Dremel that spins around, and we take off a few layers of skin, and it bleeds. So it's not like a microdermabrasion. It's a lot more involved than that.